Hi, for this month's Clinical Pearl, I thought I'd show you something that has kind of occurred to me over the years when I'm treating SI dysfunction. And I think I make the right call with all of the hypomobility testing, but just to make sure, I have found that when I test certain muscles associated with the respective SI joint, I can find them weak at times, and that also helps me to confirm my diagnosis. For instance, if all of my hypomobility testing shows me that the right SI joint is the one that is dysfunctional, and I go ahead and treat it, it's interesting because when I show the patients the exercises, many times they're much weaker doing that exercise. For instance, if it's my right joint that's in trouble, I'll sit down here, I'll lay down on the table, and I cross one leg over to advantage this and get the other leg, the left leg, out of the formula. Then I use my left arm, so I'm using my lat on the left and my glute on the right. And I'll have them raise up in the air, just like that. And I'll do that as an exercise. And they may struggle with it. So what I'll do is say, just for laughs, reverse everything. And when I push up like that, it's much easier for them using this pattern. That confirms my diagnosis, if you will, that the lat on the left and the glute on the right are having difficulty because they've been inhibited by the dysfunctional muscle. So this is how I'll have them do their exercise, pushing down on the left and raising up with their right hip. To take that concept even further, if I have them put their right leg up on a phone book, that's just a phone book with duct tape on it, hold on for balance. If they keep the knee straight and raise the opposite leg up in the air, that uses the right gluteus medius. And I find that the gluteus medius and maximus also can be weak on the same side with long-term SI joint dysfunction. So I'll have them do it this side to a comfortable fatigue, and then I'll have them compare what it's like on the left side. And most often, again, the side that wasn't dysfunctional, they have a much easier time doing the gluteus medius work on that. Those are just a couple of little tricks you can use to confirm if you got the right SI joint and it was dysfunctional.